you could please. Thanks, Jessica. If you could please put a CM in front of your name. So when we are doing introductions, it's easy to identify you. Not that I don't know who you are already, but the participant list changes when people are added to the room. So thank you for doing that. Brenda, I'm not sure you can put liaison anymore.
I'm going to hold the title for as long as I can.
Not that that's not what I meant, but should it be a little more formal than liaison? I wasn't sure. I'm very excited for you. Oh, it's 9:32. Mark, are we still having quite a few people come in?
It looks like we are, and we're just, oh, it looks like there is a quorum present, but it does look like we have more people coming into the meeting room.
Okay, we'll give it just another minute.
Maybe even until 9:35 for the
Sure.
OHA wellness policies.
Jessica, would you mind going back to the title slide, the one that says the Oregon Healthcare Workforce Committee meeting? Thanks. Good morning, committee members. Once again, if you could put a CM in front of your name, that would be great. Good morning, Paul. Is there snow up north for all the Portland folks that live up north? Is there any snow up there?
Not in Hillsboro.
Not in Beaverton.
Apparently we had some between here and the airport last night.
Up here.
Well,
You're supposed to get it on Saturday, right?
yeah, it's I know above Union Creek, they close 62 down, so you can't get to Diamond Lake unless you, well, I guess you could go around, but it's pretty, the Siskiyous and the summits are pretty nasty. I don't know if anyone has ever been up to Union Creek to Becky's Cafe, but if you ever come to Southern Oregon and you want to head up that way to Crater Lake or Diamond Lake.
Best pie around.
Best pie ever. And the huckleberry pie is usually gone by 9 a.m. So if you don't get there early and get huckleberry pie, you will not get any huckleberry pie. But it is absolutely the best. Are we slowing down a little bit, Mark?
I think so, Laura. Maybe just another 30 seconds.
Okay.
We're all anxious to begin the meeting and have the conversations today.
Good morning, everyone. Thank you again for joining us. This is the January 10th. Welcome to 2024, first meeting of the year for the Healthcare Workforce Committee. I hope everyone had a good holiday season, and I, for one, am looking forward to 2024. So thanks everyone again for being here. And just a couple of items. This meeting is open to the public. I don't know if we have any public comment. If anyone is on the meeting and you would like to give public comment when we get to that point in the agenda, you can raise your hand or send a message to Jessica, and then we will certainly address the public comment then. We are recording the meeting. Again, live transcription is available as it is for most all meetings. If you are able and willing to turn on your camera, please do so. We always like to see your smiling faces. So again, welcome. We are going to begin with introductions. Committee members, I will call on you. And I am going to start with myself. You can take my picture off of there, Jessica, because I don't like to look at myself for 10 minutes while we're doing this. So my name is Laura McKean, and I am the Senior Director of Oral Health Services and Community Engagement for All Care, one of the CCOs down in Southern Oregon. And I know we do have a number of OHA staff on the line today with us. If you could please type your name and what department you're with in the chat, that would be great. But I am going to go ahead and start doing introductions. And I would like to first acknowledge that we do have Brenda Johnson with us and Dr. Hemmings from the Oregon Health Policy Board. So I'll go ahead and start with Brenda.
Hello, everyone. It's my pleasure to be here. I continue to serve as your liaison. My name is Brenda Johnson. I use she and they pronouns, and I'm excited to be part of your agenda today. Thanks.
Thanks, Brenda. Dr. Hemmings.
Hello, good morning, everyone. Rosemary Hemmings. I go by Dr. Hemmings and I use she, her pronouns. And this is my first time, I think, attending as a Health Policy Board member. Thank you.
Thank you, Dr. Hemmings. We're very excited for your appointment to the board. Okay, we will go ahead and do committee member introductions. Aaron.
Good morning. My name is Aaron Hines. I'm the Chief Executive Officer at Yellow Hog Tribal Health Center.
Thanks, Aaron. And my co-chair, Paul.
Good morning, everyone. Paul Gorman here. I use he, him pronouns, and I'm a retired professor of medicine from OHSU.
Thanks, Paul. Ian.
I'm Ian Strauss. I use he, him pronouns. I am the Special Projects Coordinator at Whitebird Clinic, a federally qualified health center in Eugene, Oregon.
Thank you. And Aubrey.
Hi, good morning. Aubrey Corbett. I use she, her pronouns. I'm a primary care provider with Central City Concerns, Blackburn Center, and I have QHC in Portland.
Thanks, Aubrey. Elena.
Morning, my name is Elena Shablowski. I use she and her pronouns. I'm a general dentist and dental director at La Clinica, which is a federally qualified health center in Medford.
Thank you very much, Elena. And Daniel.
Good morning, everyone. I'm Daniel Ornelas. I use he, him pronouns, and I work as a dental operations manager at the Virginia Garcia Memorial Health Center. Thank you.
Thank you, Daniel. Gabby.
Good morning, everybody. My name is Gabby Carrillo. I'm the Director of Clinical Placement at Sumner College Nursing Program.
Thank you, Gabby. And Jason.
Good morning, everybody. My name is Jason Johnson, he, him pronouns. I am a dean at Portland Community College, and I support a portfolio of healthcare programs.
Thank you, Jason. And Coy.
Good morning, everyone. Coy Vu, pronouns she, her, hers. I'm the Executive Director of the Coalition of Community Health Clinics.
Thank you. And am I missing anyone? I don't see Bhavesh on here.
I'm here.
Oh, hi, Dr. Chaudhry.
Hi,
Sorry about that. I
no.
always look for the CMs, so I apologize. I didn't see that.
No, that's my bad. I didn't put it, and I'll make sure I put it right after I introduce myself. So my name is Dr. Chaudhry, formerly a dentist, and currently for the last few years, I've been serving as president of Capital Dental Care, which is a dental care organization in the state of Oregon, and in addition to that role, I also serve as a member of HITALK, which is the Health IT Oversight Council, and I also serve as vice chair of the Metrics and Scoring Committee as well. Thank you.
Thank you. And if I remember correctly, HITALK is recruiting Dr. Chaudhry, is that correct?
I have to go back and look at my notes. I don't recall top of mind.
I think they are. I think we got a notice for that. So just wanted to call that out. So I think I have everybody now. If I missed any committee members, feel free to go ahead and introduce yourself, but I think I have everyone. I don't see Bhavesh. Sometimes Bhavesh comes a little bit later, but I don't see any, I don't think I missed anyone.
We are expecting one or two other committee
Okay,
members for the end of the
perfect.
meeting, Laura.
Okay, perfect. Okay, next slide, Jessica. Okay, here is a list of, I don't think this covers everyone that's here for OHA, but this is a list of our OHA staff. Just want to also acknowledge the assistance and the help and the appreciation that I myself and I know committee members have for all of the OHA staff for their support and help with everything that this committee does. I always like to just to give you guys a shout out because I know you work really hard and I appreciate it. So next slide, Jessica. Thank you. Okay, OHA, OHPB definition of health equity. This is something that I do like to read aloud. I don't like to say just this is in your packet, go ahead and look at it, but I think it's important just to acknowledge this before we start our meetings. And it states that Oregon will have established a health system that creates health equity when all people can reach their full health potential and well-being and are not disadvantaged by their race, ethnicity, language, disability, age, gender, gender identity, sexual orientation, social class, intersections among these communities or identities or socially determined circumstances. Achieving health equity requires the ongoing collaboration of all regions and sectors of the state, including tribal governments. And we address the following: the equitable distribution or redistribution of resources and power, and recognizing, reconciling, and rectifying historical and contemporary injustices. So thank you for allowing me to do that. And next slide. And these are the guiding questions for the equity framework for the Healthcare Workforce Committee. I will not read all these. These are in your packet. You can review these. Next slide. Okay, here is our agenda for today. We do have a pretty full agenda, lots of information to share with you today. So next slide, Jessica. Okay, we have two meeting summaries that we need minutes approval for, and those would be the meetings for November was our normal Healthcare Workforce Committee meeting, of which I was not here for that, Mark, so I don't know if Paul needs to get approval for those minutes or if I can still do it. And then our December special meeting. So can I do that, Mark, even though I didn't chair the meeting that day?
You are chairing the meeting. You may choose to abstain on the question of approving the minutes, but you can definitely entertain the motion and.
Okay. All right. So I will go ahead and entertain a motion to approve the meeting summaries for the November meeting of the Healthcare Workforce Committee.
So moved. This is Elena.
Thank you, Elena. And a second?
A second. This is Daniel.
Daniel. And if I can get a thumbs up from everyone that they approve, or you can come off mute and say you approve. And are there any disapprovals? I'm not seeing any, and I will abstain, Mark, from that, just for the record. Okay, perfect. And then we'll move to the December special meeting that we had. I hope everyone had a chance to review that. And again, I'll take a motion to approve the meeting summaries for December.
This is Gabby. I'll make the motion.
Thank you, Gabby. And a second?
I'll second that.
Thank you, Ian. And all those in favor, you can thumbs up or come off mute, whichever you prefer. Okay, and any disapprovals or not in favor? Oh, I forgot to put my thumb up. I'm in favor. I can vote for that one. Okay, perfect. Okay, both meeting summary minutes are approved. And we will, we're a little bit early, but we'll go ahead and go into public comment. Mark and Jessica, I don't know if we had anyone sign up from the public to give public comment. I don't believe we did. If not, we'll move it.
I did not see any public comment.
Okay, perfect. Is there anyone that's attending the meeting today that would like to give public comment? We like to give folks a chance to give public comment and share your thoughts with the committee. We usually take 2 to 3 minutes per person if there's anyone that would like to do that. We really can't give approval or comment, but we always really like to hear what folks have to say. So if there's anyone from the public on the meeting today that would like to give public comment, you can either raise your hand or come off mute, and we will give you the floor for a few minutes. I am not seeing any. Okay. All right. Well, again, we're running a little ahead, but I know we have quite a few updates and discussion from our Oregon Health Policy Board folks that are here, Dr. Hemmings and Brenda, and then we do have some OHA updates. So I think I'm going to be turning it over to Brenda first. Mark, is that correct?
Great, thank you so much.
You're welcome.
Thanks. It's a pleasure. Boy, I've got a frog in my throat already. It's a pleasure to be with you all. Today, what I'd like to do is share an update of yesterday's OHPB meeting and kind of do a little bit of a recap. Explore with you all a little bit about the board's priorities, and then have a conversation with us a little bit about one of the board's areas of interest, which is around our workforce resilience and diversity. And so thank you very much for having me today. Yesterday's meeting was chock full of all kinds of exciting topics. We started off with a presentation from Interim Director Baden, where he shared a little bit with us about the some of the work in the implementation of the 1115 waiver. Kind of put our attention a little bit toward the benefit as it will become administered over time for people who are currently incarcerated, and to kind of, I think, give us a little bit of a preview of what could and may be emerging to continue to think about continuous eligibility. We had conversations also to talk about the onboarding of Dr. Hathi, who is OHA's new director, who will be joining the agency next month. A little bit of a preview of some onboarding work that the agency will be endeavoring, and then also into thinking about, for the board perspectives about how to onboard and work through that big major transition and how we can be in support. We did talk a little bit about some of the OHA leadership positions that are currently vacant, and Dave's kind of interest, or gave us a little update on some of the recruitment for some key positions as well. Our agenda moved into an update on the public health emergency unwinding and the updates relative to redetermination, both the pathway and where Oregon stands compared to other states across the country, as well as some of the glitches in the systems that people have been experiencing in terms of moving both from OHP as it once was to the basic health plan. And so we learned a little bit more about that as well. Proud to say that Oregon has, by ranking, taken, I think, second position across, I think second only to the state of Maine, for the numbers of individuals who have been continuously enrolled. And so there's a lot to be said about other states that have had major drop-offs in OHP enrollment as a result of the public health emergency ending. So there's a lot to be said about, even though it's complicated and not ideal sometimes for many people, Oregon has fared better than other states. We had a great presentation from the Ombuds program, and we are always interested in understanding from a consumer voice what is emerging in systems that are really challenging for people to navigate. And they specifically highlighted areas of focus for us on children's mental health, lack of access to resources, timely inpatient referrals, lots of other issues around coordinated payments across multiple CCOs that were highlighted for us. This was, I think, always, comes through the voice of the consumer, which is really, I think, quite important for our board to continue to stay engaged with, and thinking about how, while we talk about systems when we're impacting people's lives, what we can think to do differently as a result of what we hear. So again, very important content that we reviewed. We then heard from the Medicaid Advisory Committee. They were spending some time and interest in terms of both regrounding, I think, the board about its role, scope, and responsibility. There's quite a big body of work that MAC, or Medicaid Advisory Committee, is responsible for, both by statute, by collaboration with OHPB. And so reminding us, I think, as a group around their scope of responsibility, and then also engaging us as a board around where we think some of the future planning can intersect with the MAC and with the board. Also an interest in, for sure, they've done such a great job of having consumer voice on that committee itself, and so thinking creatively about how we can leverage that particular voice in that mechanism too. We listened to public comments. Public comments this time were primarily framed around two different, one big body of work around opposition to some of the mergers that we also received updates in from the HCMO report, which is a committee that's looking at mergers and acquisitions. And so a Corvallis Clinic merger that was up for public comment, as well as, has been in the news quite a bit, the Scan and Care Oregon merger as well. We then spent the balance of our meeting really working through our Oregon Health Plan, our Oregon Health Policy Board priority areas. And I'll talk about that in a minute. But before I do, there's a couple noteworthy changes on the board. So our board chair, Oscar Arana, finished his term at the end of December. I've been appointed as the board chair for the following year, and I'll hold that commitment for a period of a year. Kirsten Isaacson is our vice chair. We also will, Dr. John Santa, who's been a longstanding board member, his term also ended, and we'll be able to honor him at the February board meeting. So we've got some recruitment of some new board vacancies. There's quite a cumbersome process, to be quite honest, that goes through the governor's office for these board member appointments. The board submitted 4 names to be vetted and considered by the governor's office for 2 vacant positions. And so we think that appointment process, if all goes according to schedule, should happen sometime in the month of February, and then we'll welcome new board members to the team. So to the OHPB strategy, or rather priorities for 2024 and 2025, I think we've got a slide in the deck, if you don't mind bringing that up. We'll show you a little bit about this visual display, and I'll walk you through a little. It's still emerging, and Dr. Hemmingson and I and our board colleagues are trying to figure out how to make meaning of all of this. So quite honestly, it's pretty hot off the press. So I'll give you a little background around how we evolved to this particular diagram and the meaning of it that is kind of undercurrent the diagram itself. But and then we'll talk a little bit about the stars, and we'll talk about what it means to have workforce resilience and diversity on this particular map. So how do we get here? The board has been, through a combination of a lot of listening since, I would say, kind of mark time, gathering a lot of input since August of last year. Held a strategic planning retreat in the fall, and then finalized our priority areas of focus for 2024 and 25, voted on it at our December board meeting. The process of engaging a lot of feedback really then landed us on this particular diagram, which in essence continues to remind us that health equity is the priority for the board. To arrive at that decision was not without its own series of a lot of conversation over significant periods of time. So a significant direction to stay the course in health equity. Really, I appreciate, Laura, your reading of the health equity definition at the beginning of this committee. I've also started to do that at the board as well this month, in part to keep it focused and not to remind us that as we listen to presentations, as we think about the decisions that we're making as a board, that this is the landscape and the lens by which we make our decisions. So how to hold that center and first and foremost in everything that we do, I think will be a big move for us in this following year. The next ring of this diagram attempts to describe how we want to express health equity through different mechanisms. So if you start with the blue section, you'll see it is across the organization. And what that means is when we say, how is health equity expressed in OHA leadership, for example? How is health equity expressed through our own board performance? How are we thinking about health equity through the lane of consumer and community engagement? So these three areas, you know, if we think about future board reports, we're going to be asking presentations to come through that particular kind of viewpoint. Similarly, if you look in the what is in this diagram, it's in red. In other diagrams, it's in different colors, but in here you'll see the three sections that are connected to policy. So if we think about how health equity is expressed in policy through the concept of affordability, there's a big movement underway and has been for quite some time under the total cost of care program and the reduction of total spend in healthcare. So looking at it through a health equity lens, what does it mean for affordability for people who are making the trade-offs of their daily living expenses compared to what they're spending in healthcare, as an example. So we want to use the momentum of health equity to drive conversations about affordability in a different way. I'll come back to workforce resilience and diversity. I'll move then to behavioral health. Of course, this is a major priority for the governor's office and our conversations at the board itself. We said at first we were thinking about three major priorities and then not without its own significant and I think really productive conversation added behavioral health as our fourth. The momentum around behavioral health, there's a lot of many tables that are set to have these conversations, both within the agency, within the governor's office and elsewhere, to think about what are the primary approaches for behavioral health improvements across the state. Lots of investment that we're all aware of has gone into this particular service area, and there's a lot to be done. So I think our board will be challenged to identify exactly where our areas of focus in behavioral health are best placed and in alignment with where the governor's office wants to go. So we've got some more discovery to do there. And then within structures, the three that are named here, metrics and waiver implementation, and then CCO procurement. And so these three metrics is through the idea, again, how do we get better understanding about how health equity is or is not being measured? So we look at injustices through the frame of measurement and then think about how that drives performance. So more so than just in the metrics incentive programs that are available through the CCOs, but thinking across larger viewpoints of metrics sort of writ large. It's an entire body of work that is very complex, and we're looking forward to doing some deeper dive in that territory as well. As I mentioned, we'll be receiving updates on the waiver implementation. It is a body of work that was really significantly part of the board's interest this last year and has moved from that policy section, I would say, into structures, because as we're navigating with CMS around what is allowed and not allowed, there's still some moving pieces in that. The climate change benefit is an example of one that is now being emerging, or health-related services that have been in play for a while, but now thinking about how they actually show up in communities. So we'll be tracking some of that. And then CCO procurement. So for those of you who live this world, many of you who either represent DCOs or are very familiar with our CCO world, the board had a really big role in doing community engagement and listening sessions across the state during the time that CCO 2.0 came into fruition. And so the governor's office has tasked us to look again during what if it's called 3.0 or, you know, whatever the next iteration of CCO procurement will look like, that the board will also help set some guiding structure connected to that as well. So I know that's a lot to digest. Let me tell you a little bit about the stars, and then I'm happy to answer questions. And then we'll come back to what does it mean to have workforce resilience and diversity listed here. The stars, the process of establishing what this means for us was a collaborative process between the governor's office and the board and board leadership. In essence, the governor submits or has a history of submitting letters to the board around these are the areas of focus that like the board to really dig in on, you know, in the subsequent year. And so in the past, we have received a letter from Governor Brown, for example, that basically said, this is where I want you to go. This time around, it was quite a collaborative process, back and forth, kind of iteratively saying, where are the areas of what the governor is really wanting some additional support and lift in, and what are the areas that, you know, the board in and of itself has already a vested interest in really highlighting and doing some deeper work. So the arrival at these stars has been part of that process and then affirmed. If you look at the board's materials, you'll see the governor's letter and the way that that is crafted for us to kind of set point on these areas in particular. So I'll stop here and see, that was a lot, and see if anyone here has any questions that I can help illuminate. Dr. Hemmings, if you have anything else that you want to share, you know, relative to this modeling.
No, I don't. You know, just a point of reference, I've been on this committee prior to being appointed to the Health Policy Board. So my attendance here is really, you know, based on that relationship. And I leave it to you, Brenda, to determine what my role will be, if any, as it relates to the Health Policy Board moving forward.
Yeah, thank you. Thank you, Dr. Hemmings. We're to that point, we're also in the midst, and this is kind of in the lane of OHPB performance. We're trying to figure out how to support all of the committees of the board in our liaison functions. You know, the assignments as we onboard new board members like Dr. Hemmings. We've got Dr. Gorman also as a new board member, trying to think about liaison placements across the map. And then also thinking about what is the role and responsibility for us as individuals to do a deeper dive or spend some extra time on some of these key hot topic priority areas for the board. And so we're in the midst of trying to ascertain exactly what that looks like, which is why I said I want to be your liaison until that makes sense that there's a natural handoff. Dr. Hemmings is a clear, having been participating on this committee for some time, if she's interested, and we'll talk about her time and availability offline, but to support this committee. So any other questions, or are there questions from any of the committee members about the map itself?
I'll chime in. I guess maybe not about the map, but or maybe where would you see our work on this committee? Like, is there a bucket where you see we could really plug into this sort of this flow of work, or an ask that you would have of us as the policy board takes this on?
That's really great. Thank you so much. I'll pay you for that later, Elena. It's a great segue kind of a question. I think let me tell you first what my reaction was in both supporting this committee for several years, feeling personally deeply committed to the workforce work that this committee and the staff do. And how the conversations went forward by whether or not this section of our wheel was starred or not starred. So I'll give you kind of a sense of the way the conversations went, both in the strategic planning retreat, in the small groups that we've had, and where we're thinking, or at least I'll just speak for myself, where I'm thinking about the intersectionality of workforce relative to everything that's here. So I think there's a common recognition that in all that we've been through with workforce shortages, that we can't achieve many of these things without a really vital, thriving, and healthy workforce, full stop. The parts around it being kind of, I think about it like it's an underbelly for all of the activity that happens on top. I'll come up with a better word for that, but you get where I'm going. It's like they're conditional. You can't do metrics and scoring without a, vital workforce who's actually doing the care to provide the outcomes that we're going to be tracking to. So there's kind of some of that. And, similarly in the behavioral health conversation, we were thinking, well, workforce related to behavioral health, how you can start to see this model expand and overlap with one another a little bit. Workforce and what we want or what we might be thinking related to workforce metrics in and of itself, so if metrics is only in health outcomes and reporting, that kind of thing, but what about how are we tracking to and understanding using data to really evaluate our workforce needs? So I start to almost draw these lines across this map in ways that I think may be of interest to this committee. So to get to, Elena, to get to your question, I think more discreetly, one of the things that is an option, I think, for this committee and committee leadership to be thinking about is if, as you develop your 2024, 2024, 25 work plans, knowing that this is kind of the modeling that we're going to hold steady over that period of time, does the committee see itself providing meaningful support to any one of these domains? So it is in the, like, where do you want to see yourself, if that makes any sense? And on several occasions, I could see where the workforce committee, the board may ask the committee, hey, will you take a look at something and do some deeper work in it so that we can understand it from the perspective of the kind of this intersectionality viewpoint. I think it's also quite possible that the committee could say, hey, board, we want you to be informed and aware of some of what's moving in this committee so that we keep it on our radar in a very specific way moving forward because of the intersectionality that I just described. So we got a preview. So we used this model in part of our conversation yesterday, and we said, okay, well, what would it look like to say, a deeper dive? And I'm going to use affordability because that's the one that we talked about. And we asked Sarah Bartleman, and she had been working through the committee of a series of, in fact, the calendar for 2024 as a way to visually represent that committee's work plan. So here's the educational webinars that are planned. Here's the body of work that is kind of listed out for the course of the year. One of the things that I haven't yet talked with this committee leadership, Mark and Laura, Neelam, all of you really yet about, like, if you were to create something that looks very similar to that, when we might think about bringing the committee's work to the board agenda, and at what month, so for example, I really advocated heavily for sustaining this little piece of the pie here called workforce resilience and diversity. And I think about, like, when does it make sense for this committee to report to the board on that specific domain? There's a body of workforce work that sits outside of it, but recognizing that stabilizing the workforce from this resilience perspective and recruiting and retaining a diverse workforce was what got labeled in this particular piece of pie. It seems to me that we're going to want to hear about that, from you all. So that's a little bit more of an expanded answer to your question, Elena. Did I hit the mark, or did I answer a question you didn't ask?
You got it.
Okay. Okay. Yeah. And frankly, this is the open conversation, I think, for us for today, really hearing from you all as a committee about where you want to play. Because I think the table is wide open, quite honestly. Yeah. Go ahead, Laura. Yeah.
Thanks, Brenda. I need to lower my hand right away. If I don't do it, I'll forget. So I always like to do it right away. So I was trying to figure out before I asked my question, how I was going to ask my question, because we had a Healthy Teeth, Bright Futures coalition meeting yesterday. It was the data and workforce meeting, and the discussion was all about workforce and, how can we move forward with what we're doing when we don't have a sustainable workforce. And I think what comes to mind for me is in the CCO Ops collaborative meeting yesterday, they were talking about the CCO enrollment limits that are going to probably be coming into play based on the network adequacy.
Yeah.
And, you know, I always like to champion for oral health and workforce in general. And so I brought up to Dave Embody, you know, I think that whatever they're doing there, they're going to do, but it's hard to place those kind of limits on the CCOs when I feel like they're not taking looking at the big picture, I guess is what I'm trying to say, because you're going to put enrollment limits on the CCOs that are struggling to maintain oral health workforce, behavioral health workforce. So it just feels like, okay, that's just one more nail in our coffin sometimes. And it's very frustrating. So I think my question is, you know, as far as how can the Healthcare Workforce Committee work with the Health Policy Board to kind of bring some of that back to some of these bodies at OHA to, I mean, I think they listen to us, but they don't really hear our frustrations. So I don't know how, because my questions usually are, you know, they try to answer them, but they're not really answered. So I think what I'm getting at is, is there support that the Healthcare Workforce Committee can get from the Health Policy Board to bring what we're working on to try and address some of these issues back to the OHA folks and let them know that we're all trying to work together to make this work. But when you start putting these, what I feel are barriers and limits, and, you know, we won't even get into the deliverables. How can we work together to address this rather than just say, okay, we're going to put enrollment limits on there when we can't even maintain a workforce to do what we need to do?
Right. It's such a great, well, let me respond to how I hear you, Laura, and it is exactly how my brain is working lately. It's like, and let's just keep coming back to this map. You're talking about CCO procurement too. You're also talking about metrics and scoring when you're saying that, right? You know, so those are two star priority areas. So when I think about that specific ring, you know, around the map, how I think our challenges at HPB and each of the committees and the staff work is to look at the interrelationship between them, to your point. You know, if we're talking about access and affordability as a primary driver and a very unmet need inside our state, right? And just, I'll just speak Medicaid only for now, but of course that's far beyond Medicaid, which is also in the board's purview. But in Medicaid alone, if we don't think about what are the limits and the limitations from the workforce perspective, then we may see pushes in certain parts of this puzzle that aren't connected. So that's how I hear what you're asking, or kind of your reference point. So how do we work that through? My instinct tells me that we have to keep the conversation data focused, and that if we want CCOs, and I'll use that as an example, to demonstrate access, then understanding also what they're doing relative to workforce supports. Is it instead of just demanding, you know, similar to metrics, we can't just lay new metrics on top of an already fragile ecosystem. So how do we think about where is the workforce relative to metrics? Where is the workforce relative to, you know, access measures and the like?
Yeah, no, I appreciate that. And I know Elena, I know Dr. Chaudhry's on, and you know, it's like, and Dr. Chaudhry, I think, has heard me say this before, but, you know, I've been in the dental field 40 years. I've been a dental assistant. I've been a practice manager. So, you know, from a CCO perspective and my job, I feel like I'm hammering these DCOs about workforce. Sorry, Dr. Chaudhry, workforce, you know, you got to get providers in here. We got to see these members. But at the same time, I've been on the other side. I know how difficult it is to keep staff. So I feel like I'm trying to defend, you know, the DCOs to my leadership and say, you can't squeeze blood from a turnip. And I know they're doing the best they can to get workforce, but it's so hard to get providers. So I think, you know, I'm turning some things in my head of how how we can come together maybe and help support this work.
Yeah, yeah, that's great, Laura. Thank you. I think there's very similar conversations, you know, when I participated in this committee over time, that feels like a very common theme, you know, and so there's a little bit for me, which is like, how do we keep it at the top of the conversation, you know, or continue to think about what's reasonable and I think, frankly, using information and data to tell the story is more compelling than what feels heartfelt, real, and also emotional in the workforce space, if this makes any sense. So, and for those of you who don't know, I lead a federally qualified health center here in Southern Oregon at La Clinica, and I live and breathe this concern every day in my work. So there's a part where it's like, I know I can tell what people are actually listening to, which is, of course, we want to do great work. Of course, we want to be safe. Of course, we want to, you know, really move the dial on social determinants of health and health outcomes in this equity framework. And, you know, so it's always this yes and from my perspective, which is a position that seems to gain greater traction than no, we can't because we're suffering. And I know that might be just through the brain that is sitting right here. You know, it may not be a shared opinion, but I think it generally, I notice in some venues, it lands more effectively. You know, if we can say how, you know, help us to, yes, and how, because we're struggling over here with this other big body. Yeah.
Okay, thank you.
Yeah, you bet.
My wheels are turning, so.
Yeah. Yeah. Okay. So it's, unless there are other questions, I think what I'd love to do is give an illustration of one possible area of influence that this committee may want to think about. And it's really sweet because I got to participate, I think, at the November committee meeting where we were talking about how we capture data through the licensing boards, about kind of the level of concern that exists in the workforce itself. And I think at that time we were labeling it a burnout survey. I know now we're thinking about it through this other lens, burnout being the thing we want to prevent and address. If we change the conversation a little bit by the choice of our language to wellness and resiliency, we may talk about what we want to foster and how we may want to advise the board around resources and support to foster wellness and resiliency. And so I had this great conversation with Piper, and thank you for joining. I saw you came off on camera for this next part of the conversation. I think I'll just let you give us all an update, or ask you to give us all an update on where things stand, and then perhaps turn it back to Mark and Laura to help us discover what we might want to do next. Does that sound reasonable? Okay, great, Piper. I'll just mute myself and turn it over to you.
Great. Can everyone hear me? Okay, I see some thumbs up. Excellent. So I am Piper Block, she, her pronouns. I am the research and data manager for the Office of Health Analytics at Oregon Health Authority. And my team and I came to you in November to discuss a project we were hoping to put into place. So I want to give you a little bit of an update on that. It's the Wellness and Resilience Data Collection Project. So just to set the stage, our team for the last year, we've really heard this statewide and really national dialogue about how urgent the issue of provider burnout is. We also heard your committee and subcommittee discussions about provider wellness, how to brainstorm ways to support providers. And we responded with an idea to collect systematic data about the prevalence and drivers of burnout for providers, since we already collect data from them during our license renewal survey. So our initial plan was twofold. So we suggested putting 2 questions into our license renewal survey, a burnout screener and a contributing factors to burnout list, and then to offer a voluntary survey with lengthier scales that went into kind of the drivers of burnout that could be completed at the same time as a license renewal, but would be separate. So to give some intentions about these two parts, just as a reminder, for the first part, the 2 questions on the license renewal survey, we believe that having this relatively unbiased population level measure about the prevalence of burnout among Oregon providers would be great, because then we could see, what percentage of providers, which type of providers are most likely to experience burnout. What differences are there by race, ethnicity, and gender, by region? Who is experiencing this the most? It would also give us kind of a baseline, a point in time estimate that we could then follow up in the future as different initiatives and programs come into play to address burnout, to see to what extent they've had an impact on that issue. And then we thought the voluntary survey would be a way to understand, again, the drivers, understand the reasons why folks are experiencing burnout, so that we could better gain insight about potential solutions and supports. So just kind of filling in the details of why folks are experiencing burnout. So we've had discussions with both the Oregon Department of Justice, DOJ, as well as licensing boards. And so based on both of those, we've continued to hone and somewhat modify our approach. So in terms of our discussions with DOJ, we were already kind of in discussion with them when we presented to you, specifically to find ways to assure providers who are taking the voluntary survey that their data would not be directly given to the licensing boards at the individual level. We wanted to make sure that that we could kind of protect their data, that they wouldn't be feel that their job was in jeopardy for answering those questions, that none of that voluntary survey information would be used in any type of investigation. So based on our discussions with DOJ, we're separating that voluntary survey completely from the license renewal survey now. So it'll just be on its own timeline. We're seeking our IRB approval as well. So this will be more like a research study in that way. And we're partnering with licensing boards to put that into place through their contact lists. We also, like I said, had conversations with the boards, and this is kind of where we'd love some more thought partnering from you. So some of the boards had serious concerns about adding any questions about burnout to the license renewal survey. So they had concerns such as overburdening licensees with additional survey questions, the confidentiality and privacy of sensitive information, even just these 2 questions, and mentioned how for some types of providers, they're already being asked about burnout in several different contexts and don't necessarily feel like anything's happening in response, which are all very valid concerns. In any case, we were expecting to have some kind of landing page at the end of our survey to offer resources that are available in the state for provider burnout, and we will still continue to do that. But that's different than somebody individually reaching out to someone directly with immediate resources. So the boards are our partners. We want to be good partners to them. So of course, we're not going to implement any new survey questions here without their approval. And we hope that can be kind of an ongoing discussion, potentially looking into the future of ways to accommodate their concerns. The boards that do have major concerns about adding questions to the main license renewal survey, they were all still very willing and eager to work on the voluntary opt-in survey with us. So offering their contact lists, offering to help promote that survey to get a good response rate, things like that. there are boards that are interested in collecting the burnout screener and contributing factors list. So those 2 questions on the license renewal survey. So for those boards, we will start the data collection process this year in 2024. Those questions will be optional. So that was always going to be the case, that even on the license renewal survey, they could skip those questions. So just to kind of summarize, we're creating a voluntary survey that will be completely separate from the license renewal process. And then we'll add these 2 burnout questions, the screener and the contributing factors list, either to the license renewal survey or to the voluntary survey on a board by board basis. And I do just want to underscore this does mean that for those that choose the voluntary route, it won't provide us with kind of a population level estimate of the prevalence of burnout, which is certainly unfortunate. I think that's an important thing for us to know. And to my knowledge, there isn't another measure of that in Oregon to understand like the level of burnout, the certain demographics of folks that are experiencing burnout more. I do think that would be helpful in advocating for resources for this issue. But again, we want to be good partners to our boards and want to work with them and address their concerns. I see that there was a question in the chat already, so let me pull that up real quick. So the question was that did we consider interviews and focus groups to understand these issues rather than a survey? Yes, that's a great question. We had considered doing kind of semi-structured interviews as well. That's something that we could still talk through. I do think that would give us more of the kind of why, the sense of what's driving these issues more. Yeah, so I think that would kind of fill in the landscape. So I would love to hear from folks, reactions, questions, comments.
Committee members, do you have any comments, questions?
Yeah, Manu, you go ahead.
Oh, please, you first. You started. Go ahead.
Okay. I thank you so much, first of all, for listening to the feedback about the confidentiality. I think that was a really important conversation at our last meeting. And so thank you for figuring out a solution to deconnect, keeping the data of the profession, but separating it from the individual. So thank you for that. I think that's super important to retain, no matter where this goes or what happens, keeping that confidentiality and communicating that in the process of the survey. Like question answers from here on out will not be like tied to your name or whatever. And then I just wanted to, second your point about this is awesome for licensed professionals that take these renewal surveys through their licensing bodies. And I think our ask or intention in the wellness and resiliency report was also to get that more population or healthcare wide look at burnout. So to acknowledge that, yes, dentists and hygienists might be burnt out, but like so might the front desk receptionists that are on the phone every day, and that we can't capture in a licensing body. So continuing to keep an eye on how to capture that information, whether it's through focus groups or through more of a an allied professions survey that might not, might be harder to communicate or distribute, but would still provide valuable information. So those were my 2 reactions. Thanks, Piper.
Sorry, can everyone hear me? I'm not sure if my technical issues.
We can.
Okay, perfect. Thank you very much. So first off, Piper, thank you very much for for all of your due diligence or all of you and your team's due diligence. I think it's even though I didn't like hearing the update that was provided, it really speaks to the amount of effort and energy and time that really went into building and creating something meaningful, while trying to keep everyone's perspectives and interests equitable and fair and just. So thank you for again for you and your team's due diligence. I think you know, reflecting a little bit on a comment Brenda had made earlier on kind of a data-driven approach, and kind of speaking more from the dashboards that the OHA team have created and have been meticulously reviewed, is that we've seen a large percentage of dentists who practice and dental hygienists who practice drop since the beginning of COVID. And off the top of my head, I would say that's roughly 4 to 6% drop across all dental providers over the last few years. And kind of with that in mind, I am painfully aware from my stance on the metrics and scoring committee that without having a resilient workforce, we're unable to continue to achieve aspirational goals that are set forth through quality incentive measures that the state and the metrics and scoring committee really decide upon. And so as there have become more and more downward pressures on retaining providers who care for the OHP population, I think there still is a lot of important data and important information that can come from performing the survey. And finally, now I think the question that I have is, and this is kind of more raised to others on the Healthcare Workforce Committee, if we really truly believe in the data and the need of this data, is this something that we can request other organizations to survey and then feed that into the information collected and reviewed at Oregon Health Authority? And specifically, I think I'm kind of leaning in on CCOs and DCOs like myself, who could then survey our providers and evaluate if there's any burnout or other related questions that can then be communicated back to OHA to look at things from, you know, a population of provider perspective, and again, specifically addressing the needs and interests of the providers who treat OHP members.
Quiet, Brenda.
I was just thinking a little bit about like, wow, how the CCOs might react to that very proposition, you know, and such a great alignment. You know, here we're talking about the pathway through the licensing boards, you know, and then if we think about the CCOs having greater visibility about what's happening within their own network. I think the question about the pathway of the collection, you know, may influence the engagement rate, may or may not, I don't know. I'm mostly thinking about just emphasizing or echoing the importance of this data to make substantial policy change. You know, so I think I don't know that there's a perfect path. I think, you know, what I want to emphasize is I want to use the Oregon Wellness Program as an example. Without the data in some sort of population-based format, I think it'd be really challenging to argue the point of continued or more investment, say, in a program that we know is already working. You know, so there's something about, like, you know, this committee's ability to use its influence in, if not the licensing board path, I'd still love to stay course there, but I don't know that I might be alone in that opinion. also other mechanisms. So we really like the cool part about the licensing board path from my perspective is it helps us understand what our could potentially give us better indications about what our pipeline development could look like into that sector. You know, if we understood how fragile a specific sector actually is, we might find that we're making some general broad-based assumptions and there's more resilience concerned in a particular, you know, with a nursing board compared to the dental board. I'm making stuff up. You know, it may be equal, it may be different. And so our actions would be different proportionally, you know, across the large population. But I don't know, I'm just riffing. I don't know that I have anything of value to share, but I just struck by the pathway probably matters. Yeah.
And I actually agree with you, Brenda. I personally prefer the licensing board approach. It's just the tone that of what we had just heard over the last 10, 15 minutes seemed as though that there's already a lot of barriers by the licensing boards. And I don't know how to get around that. It seems as though we've done everything we can to try to influence and motivate and empower licensing boards to review this within their licensees. If there is, I prefer that path. I'm just trying to think of an alternate solution if we've been stonewalled.
Yeah,
I'm
that's
sorry.
great. No,
Sorry
I
for
love it.
the figurative expression.
I love it. I love the momentum to stay the course, and I had this great privilege of talking with Piper offline about the dynamics. And I think part of the pivot, if I'm a licensing board and I'm concerned about asking the questions of burnout, even if they're optional, I think the resistance, and I don't know this exactly, but I'm speculating, would be because I don't know what to do with what I'm about to hear. And so part of the pivot in my brain went to, can we talk about our intention around wellness and resiliency, which licensing boards, they want that too, and then think kind of the parallel path of, here are the resources that we think are available should you engage with a licensee that is under-resourced or may want some support, and that's our intention. Again, as a way to jump the hurdle or to go through who knows who in the licensing boards that can have that conversation. And maybe there's a committee member here that has a direct affiliation with and could entertain the conversation, not to be too heavy-handed, but really understand where the concerns are and where, instead of Stonewall, maybe there's just one layer of brick that we don't quite understand, that we want to really get after a little bit more creatively. I don't know.
So Brenda, I really like what you've said, and I think I would like to kind of reframe the question back to Piper. And Piper, with all the different boards, or maybe even specifically, were the responses more like, was it a thin layer of bricks, or was it really truly like a Hoover Dam kind of style of bricks?
Good question. I think it kind of varied board by board. I think some were interested in entertaining the idea, but may need additional support. There were maybe just one that was pretty adamant about not doing it. And I think some of that is based on that board's specific historical data collection. And I think for others, it could be something they're interested in the future if we're able to shore up some of the other issues with the survey that they're experiencing. So I do think that there's some room. I think there's really great room for discussion here with the boards. And generally, I think this is such an important topic to kind of come together in partnership on, since we're all addressing this. And I will say all the boards are really dedicated to addressing burnout in their populations, and very like I said, dedicated to it. So I think a conversation would really lead to great outcomes, whether it's adding this question to the survey or other ideas that come out of those discussions.
So I think one piece of this that I would personally like to see as a member of the Healthcare Workforce Committee is a grid of each board and to best understand what is the holdup, because it seems as though we're hearing two different things. On one perspective, I'm hearing that, with the exception of one, there is interest if they had XYZ. And I think if I could see that kind of laid out in one simple spreadsheet, then as a member of the committee, or as members of the committee, then we can deliberate on how exactly we can provide those supports to achieve kind of the data that we all feel is necessary in order to truly advance the health of our workforce.
Yeah, I think I would want to check with the boards themselves before sending anything like that, just to make sure that they feel that we've properly reflected their concerns and level of concern. So why don't I just go back and talk with the boards that we've discussed this with and make sure that we're, kind of properly reflecting their interests.
Okay, and then I think, so thank you so much, Piper. And I feel like I've completely dominated my questions. And so I would love to hear if other members, if this resonates, if this approach resonates with other members, or am I kind of being the Lone Ranger right now?
Paul, I think you had your hand up.
Yeah, I have my hand up. Just a couple of comments. I think we're trying to understand what's going on with the workforce that's making this so difficult for them. And the main groups we've been talking about learning from are CCOs who employ the workforce and licensing boards who license the workforce. Another avenue might be professional groups. In the work that I've done in the past, it's very often the professional groups of individual professions that have the best credibility and relationship with members of that profession. So physicians, for example, trust their local professional society more than they trust the National Institutes of Health for information about what's best. So I wonder if professional groups for each discipline we're talking about might be a more effective and more valid avenue to the information that we seek. The ONA, the Oregon Academy of Family Physicians, for every individual discipline, is there a way to take advantage of the credibility and the existing trusting relationship that professionals and licensees have, or health professionals have with their professional groups? Just a thought.
Let's see, Ian.
Okay. I like Paul's view on how to address folks and where their self-interest lies. One of the things I've found in collecting data in my health center, and given we're a much smaller group, but people are enrolled in what their benefit is and where they see things coming from. So if collecting the data that we send out is an end product, then there tends to be it tends to drop poorly. At least that's where I've seen. Whereas if it's part of a process of an outcome, there's an opening there. And then where groups like a professional organization is involved, there's enrollment, there's something to grab onto. So that's just a thought in how that might play.
Thanks, Ian. Okay, we'll let Elena give her thoughts, and then we'll, I hate to move us along. This is such great discussion, but I think we'll have Elena's thoughts and then we'll move on to the staff updates. So Elena, go ahead.
Yeah, I like that idea, Paul, of involving the professional organizations. I think there would just be a mindfulness that typically the market share is between 50 and 60%. So at least in the dental world, about 50 to 60% of dentists are members of the ODA. And so want to be mindful of who is that 40%, and if we're not surveying them, or how could we make sure that they're being included. And then I know, at least at the ODA level, we get a lot of confusion between the Board of Dentistry and the Oregon Dental Association. People think we're the same thing. People think the ODA licenses people, like there's a lot of confusion. And so we'd want to be mindful of how it's communicated, especially if questions are being asked by two bodies. I think that could lead to even more confusion by the licensees and by the public even. So we just want to be really mindful about communication as we do that.
Forgive me for speaking up without raising my hand, but I just want to add to that. I think it can be confusing to figure out which professional organization we're talking about. I know for the physician population a little better. The OMA, for example, might not be as good a connection as, for example, the Academy of Family Physicians, if you want to talk to family docs, the ACP, if you want to talk to internists and so forth. So figuring out which group actually has that credibility and connection is important. And you're never going to get the population-based data you'd like, because getting the data always involves a volunteer bias. There's just no way for us to avoid that. But I think what's the most valid way to get information? And to Ian's point, I think, if I understand it, if the perception on the part of the subjects of this study is that this is going nowhere and it's going to sit in a report on a binder somewhere, then so there has to be some, and maybe just maybe you build credibility by little small steps. Like if people participated in something that ended up in something beneficial, there might be more energy than there's going to be for filling out a form that fills out some check boxes and enables someone to create a report that goes nowhere.
Thanks, Paul. Okay, this was really great discussion. Thank you, everyone. Thank you, Brenda, for all of your information. Very much appreciated. And if we can circle back if anyone has any questions, but thank you again. And we are going to go ahead and move into the OHA updates, and I believe we'll start with Mark for that.
Okay, thanks so much, Laura. Good morning, everyone. Mark or Rebecca, I use he and they pronouns. I have two updates to provide as the beginning of the staff updates. The first is to finish up and report back to you around the National Health Service Corps, particularly the recertification cycle. We had shared with you previously that there were 50 applications which came in, and we can now report that while the PCO reviewed and recommended approval for 50 applications, a total of 49 were approved by the National Health Service Corps Division of Regional Operations. Sorry, I'm looking at my other screen where this went. Let me move this over. A little bit about the review process. The Division of Regional Operations provide extensive technical assistance to sites. They held one-on-one meetings with sites. Often those included the primary care office staff. And we continue to maintain a very supportive and collaborative relationship with our HRSA, Division of Regional Operations partners, to further support NHSC participation in the state. And in case it's of interest for any of the data nerds or people who like statistics here, Oregon has now 448 individual practice sites that are certified to participate in the National Health Service Corps, and 936 sites total that are certified to offer a number of the programs that HRSA offers. That includes the Nurse Corps program. It includes the SUD loan repayment program, which those programs don't have the exact same requirements that NHSC does in terms of eligibility for providers, but 448 NHSC, 936 in all. By way of comparison, Idaho has 303 active NHSC sites on about 800. Alaska has 282 sites, 583 overall. some states with similar populations outside of the Northwest. Oklahoma has 483 NHSC sites, so that's just about the same. And they have 1,215. So a lot of activity with reimbursement, financial support of nurses, for example, in Oklahoma. Nevada, only 140 sites. Utah, only 158 sites. So I hope that's helpful. If you have any other questions about National Health Service Corps, you can reach us offline, us as either myself or Liza Root, who's our contracted NHSC specialist who could not be here today. My second very brief update is around the Oregon administrative rule updates for administrative requirements for students who are doing their clinical training work or placement work in direct patient contact. We did finish that work up. The ARCTAC, the advisory committee met, as you know, and the new rules took effect on December the 28th. So we're in some conversation around how do we ensure that health employers' educational programs are aware of the rules and are able to comply and are complying. But we're very happy about that rulemaking that took place. And it seems like the health professions are very much in support of the work that we did. Thank you. And that completes my updates unless there are any questions.
Thanks, Mark. And I think Neelam had an update as well.
Thanks, Laura. My name is Neelam Gupta, she, her pronouns. I'm with the Clinical Supports Integration and Workforce Unit. I'm stepping in for Jill Boyd, the Healthcare Provider Incentives Coordinator, who had to leave for another meeting. The Healthcare Provider Incentive Program is having a rules advisory committee on January 17th from 1:05 to 1:55 p.m. And anyone who is interested can either, in participating, can either put their name in the chat. I'll also put Jill's information into the chat as well. You can reach out directly to her.
Thanks, Neelam. Okay. All right. It is 10:53 and we are due for a break. We'll go ahead and take around a 7-minute break back at 11 o'clock and talk about our accomplishments and what we'd like to see in 2024 as a committee. So feel free to turn off your cameras while you're at break, and we'll see everyone back in about 7 minutes.
All right. Is this the screen you would like to have on when we return?
I think are we done with that screen?
We're done with that screen. I think the next screen, and there is one operational piece, Laura, and it's certainly, if you'd like to wait until the end, we can do that. Or we could do that piece very briefly before the accomplishments discussion.
Oh, that's right. You're right. I forgot. I'm looking at the agenda and I just skimmed right over that. We'll do this first. I mean, we'll do it after break. That's what I meant, Mark. We'll take a break. We'll come back at 11 and do this. Is that all right?
Totally great.
Okay, let's take our break. Come back at 11. Hi, everyone. It is 11 o'clock. Committee members, if you could please turn your cameras on when you get back, so I know that everyone is back from break, and we will resume. Dr. Charter, I see your thumb. I know you can't turn your camera on, but I saw it. I just want to acknowledge that. All right, I think we have most everybody back now. And I will go ahead and turn it over to Mark to talk about our updates and process for recruitment and election of officers.
All right, Laura, thank you so much. Members, this is a bit of operations. I want to say I really appreciated the thoughtfulness of the discussion around the wellness and resiliency data collection project. This is a little bit less deep and meaningful, perhaps, but important for the committee's operations. So Jessica, if you could move to the next slide, please. Thanks so much. So as you know, we've been underway with a recruitment process to appoint or to have the board to present to the Oregon Health Policy Board new members for 2024 who will take their place on the committee after the board is able to receive nominations at its February meeting. So we're first of all very happy to say that returning to the committee, these are members who are completing their first 3-year term and have agreed to be, or first full 3-year term, and have agreed to be standing for reappointment by the board. Gabby and Elena, Aaron came in and filled a vacancy a little over 3 years ago, but he is completing his first full 3-year term on the board, and we're very grateful that he is offered to be reappointed by the Health Policy Board. The rest of the members who are listed here on the slide are y'all whose terms did not expire in December of this year. That's Manu, Bob, Jason, Coy, Alicia, Gretchen, Ian, Larissa, Judy, and Dr. Hemmings. And then if you could move Jessica to the next slide, please. Thanks. Unfortunately, you know, I am somebody who really does not like goodbyes. Paul and Bhavesh are at the end of their second 3-year term. And I think, Paul, in your case, it's a second full 3-year term. I believe that you filled a year or so of a vacancy. Now, Paul and Bhavesh will be leaving as termed out. And then Daniel and Aubrey both let the OHA staff know that for various reasons, they're not seeking reappointment to the committee for an additional 3-year term. So those are the members who are leaving. I know Laura has some time planned at the end of the meeting to acknowledge and appreciate those who are leaving the committee. But perhaps as importantly, I want to share with you, we had an extensive review process. We used the Health Policy Board's gap analysis framework to look at geographic diversity, race and ethnicity, expertise and sectors within the healthcare system and education represented. There were a group of 8 of us from OHA and the committee who reviewed 22 applications for membership for this committee. It's the most applications we've ever received, and we're grateful for so much interest. Who we plan to nominate and send to the board for consideration on February 6th are the following people: Levi Anderson from Ontario, Stephanie Green from Roseburg, Megan Holland, Coquille, Rob Ross from Bend, Christian Thornton from La Grande, and I still do not know how to pronounce their name, but Issa Ubidia Luckett, who is also a clinician and is from Lake Oswego. We're very, very grateful for the high level of interest. The committee had a full meeting and then further discussion to come to consensus with if all of the members who are proposed for nomination agree to participate, and we're in the process of getting those reconfirmations for them, and the board appoints them, we'll have 20 members beginning in March of 2024. Are there any questions, or did I get anything wrong? Like Elena, like, no, I didn't come to the end of my term, or I didn't agree. I'm just kidding, Elena, because I know we had some conversation. All right, and for everyone who's continuing to serve, we also really, really do appreciate your the time that you take, the thought that you put in to participating in this advisory body. Thanks, Jessica. If we could move to the next slide, I'll be even faster. This is really a call out, and you can move to the next slide, Jessica. Thanks. So typically we have elections in January. We aren't doing that now. We're waiting for the new members to come in, but because of who is leaving, we are looking to elect a chair and vice chair. So that's part of the bylaws as they currently stand. The committee will be electing at its March meeting a new chair, and Laura will take her place as the immediate past chair and serve until the remainder of this year, and also looking for vice chair. The bylaws right now have the chair and vice chair serving one-year terms. There's no prohibition against having additional one-year terms, but that's what we have currently. Anybody can run. It doesn't matter if this is your first year on the workforce committee or if it's your 5th year on the workforce committee. You're eligible to run, and you can nominate yourself. You can also nominate someone else. We typically follow up with the person being nominated to see whether they're willing to accept the nomination. In a role as what will be immediate past chair, as chair, Laura has agreed to take names for people who would like to self-nominate or nominate others. Please get your nominations to Laura by the middle of February, so we can make appropriate preparations for the committee to hold an election at its March meeting. And Laura has popped her email into the chat. Thanks so much for doing that, Laura. Any questions about election? I will share there's no additional compensation for serving in the role of chair or vice chair. All right, if there are no other questions, thanks so much for your time. And Laura, I'm turning this back over to you.
Yep. Thanks, Mark. And I think I'll just add there's no experience necessary or required to do this. We welcome anyone who is interested in serving, and sometimes it's a little daunting to chair a committee like this, but I will say that I had a lot of support from Kurt, who is no longer serving with us, but as well, I mean, the OHA staff has been great. So you'll never be without support in a role like this. So, and again, thank you for the support that you all give. So let's go to the next slide, Jessica. So we wanted to take a little bit of time, talk about 2023 and upcoming 2024. And if you could go to the next slide, Jessica, please, and the next one after that. So we're going to take some time and have a little bit of discussion around 2023, first of all. And we're just going to kind of open it up to discussion for committee members. I'd like to maybe just hear, if you don't have to answer all these questions, but thoughts about what you thought about 2023, what you were proud of, if you would like to share what was significant to you for this year and impactful, important for the Oregon workforce. And I'm just gonna, since I'm talking, I'm just gonna start, first of all, it's, you know, for me, just being able to chair this committee, I think when I should be actually terming out, but I'm going to serve as immediate past chair for the next year, and then I'll term out. However, I said they're not going to get rid of me that easy because I'll come back and just attend the meetings. So for me, it's not, you know, it's not, it is 2023, but it's just a combination of the last 6 years that I've had the privilege of working with this committee during some pretty trying times, COVID especially. So I think, you know, just getting through that was an accomplishment. As far as important work, you know, I think it was the year before last, we did the nursing workforce shortage paper. But even most impactfully for me was to the work that was done on the diversity papers that we're going to be talking about and moving forward. And I, you know, I didn't have a huge role in those papers. We were going through a little bit of staffing changes. And so I didn't get to play as engaged role as I wanted to for that. But when I read them and I attended as many meetings as I could, and the work that was put into those papers by the subcommittee chairs and the members was some of the best work I've ever seen. It was, they all did so much went into that. It was very impactful. And so, you know, I think I mentioned earlier, we had a workforce meeting yesterday for an oral health coalition, and I hear people, they were talking about the health force committee, and I don't know if they didn't know I chaired this committee, but I'm just kind of sitting back there listening. And, you know, I did suggest that, that they come to this committee and listen to the work that's being done. I think there's a lot of coalitions, committees, things that are happening out there. I hear, you know, I sit on the Workforce Investment Board for Southern Oregon. That's workforce related. So I'm really going to try and encourage folks to attend this meeting and hear what's going on with the work that's being done with this committee. And I think if we can get the word out to what we're doing and get engagement from folks to come and listen and give public comment, that will really help move this work forward on these papers. So I'm going to quit talking and I'll open it up to committee members and just give some thoughts on 2023 for you. And don't all raise your hand at once or I will call on you.
I'll chime in. I second your pride in the reports. I think that feels like something, it felt different than past years, that we had something member generated and tangible. It felt like we were being more proactive instead of reactive by suggesting, you know, instead of sort of rubber stamping or reacting to proposals, we were in the position of creating the proposals. I think that if we were to replicate that process, having more staff involvement from the beginning would be more supportive. I think that I felt like our subcommittee kind of hit the stride at the end when there was a little bit more conversation between OHA staff, especially the kind of surveying groups, and also getting the support on the report from the like previous policy discussions and where policy stands in Oregon right now. That felt a little intimidating stepping into the report writing process and being like, I don't know, like, am I being asked to be a content expert in all policy that's been done around wellness and resiliency? And so I felt as a committee chair or subcommittee chair, felt a little bit or a lot more grounded and supported and productive once there was that synergy between staff and committee members. So I think having that generative, proactive process felt really good. And I think having the OHA staff, both their training, their expertise, their experience, their perspective, their relationships and connections involved in those conversations as part of the generative process instead of kind of inserting later would feel really good. So it's kind of finding that balance of we're not just reacting to proposals from staff, but we're in conversations from the beginning about those proposals. That's what I got.
Thanks, Elena. Ian?
So as a new member in 2023 of the committee, it was really nice to see that conversations that we as a group had in the early part of the year, especially around the provider incentive programs and the directions that things were going, were taken seriously and acted upon really what amounted to very quickly by the OHA staff. It really felt like there was a sense of importance to the work we were doing and that we were being taken seriously. And that really, in these kinds of venues, is very empowering. So that was my, proud to be a part of the group and proud to see the work that we're doing actually making a difference. That's it for me.
Thank you, Ian. Appreciate that. Paul?
Thanks. I think I'm most proud of the strategic framework. I really think the clarity, the simplicity, and the language of it provide. I think that's really, really strong. I think it served as the basis for the papers that were developed, and more importantly, I think it provides the committee with a true north for future work. It's like whenever you stop and think, what are we about? What do we need to accomplish? That Venn diagram kind of says it. You can start there and then figure out what to do next. So I'm most proud of the strategic framework.
Thanks, Paul. I completely agree. I don't see any hand raised, and I'm glad. Oh, go ahead, Daniel.
Thank you, Laura. I want to echo some of what other members have said in terms of the excellent work that went into the diversity papers and the strategies that were recommended. I would say what was most personally significant for me was an expansion of empathy towards our healthcare workforce in the state of Oregon. And, being in a healthcare organization, we can see the barriers that we have and the challenges within our own workforce. But once you hear from across the state that this is something that is happening in many organizations as well, and how it's impacting both the access and the quality of the healthcare across the state, it does really increase the empathy for our healthcare workforce. And I know this is not just the state, but it's across the nation as well. Thank you.
Thank you, Daniel. Paul, your hand's still up. Did you just?
Yeah, I put it back up. I did want to say
go ahead.
The strategic framework is, I think, what I'm most proud of. What's most personally significant to me was working with all of you. I think the work that we've done as a committee, it's rewarding. I value so much and learn so much from listening to the perspectives of folks on the committee and the subcommittee work especially, where I got to work more closely with members of the committee, learn about them and see those contributions build such useful and productive output. So working with all of you has been the most personally significant for me.
Thanks, Paul. I would echo that. Brenda, I think you're still with us. Don't get mad at me, but I'm going to put you on the spot. Would you mind sharing with us how you feel 2023 went for the Healthcare Workforce Committee.
Yeah. Yeah, I mean, that's not a, you bet, Laura, and you're always welcome to call on me. I really think this committee got very organized and focused. And I think it was really powerful to watch it happen this last year. I would echo Paul's comment on the strategic priorities and the framework and the Venn diagram. I mean, as that thing emerged, I thought, man, now we're cooking with, I don't know, something special. I don't know what the metaphor is, but you know, we're really on track to something special. And frankly, it made it really easy, I think, to bring that to the board conversations, you know, and kind of transport, even though it's like your scope of work is significantly bigger than what eventually kind of landed on that priority conversation, knowing this was your intention, at least one of 3 areas of intention, was really, really useful. So I love that. I was really proud of that. Always, frankly, I think the leadership of this committee, both the staff and the board leadership, Laura, your and Paul's influence have really been pretty stellar. I frankly have been like the envy of other people on the board to say that like what happens in this particular committee is really top notch. So there's many ways in which I think you hold committee engagement and really tapping on the resources of people in this group that is pretty significant. So I find it really rewarding personally. And yeah, and I spoke to the significance. I want to tell you that for 2024, I know that I may be jumping the agenda, but since you called on me, I've been doing this thing inside our organization about slogans like 2024 is the year that we, you know, and this committee, the year that we. So what I'm thinking about for this committee, my aspiration would be 2024 was the year that we made meaningful progress in workforce resilience and wellness and influenced other parts of a big complex system. That would be like my aspiration for this following year.
I'm glad we're recording that because I want to write that down later, and I didn't write down what you just said, but I want to. So I'll go back. Thank you, Brenda. And you know, I don't know about the other OHA committees and the liaison support that they get, but I do appreciate you being so engaged with us. It's very much appreciated. And I think, you know, as we look into 2024 and we start maybe some work on the strategy papers, I think one of the things that I remember saying when I first started chairing this committee is I didn't, and this doesn't mean no disrespect to OHA folks at all, but I didn't want this to be a yes committee. So I didn't want us to just get work handed, you know, brought to us from OHA and said, this is what this committee, this is what we'd like you to do, please do it. I really wanted this committee to be the inventor and the driver of the work going forward. And I think we have accomplished that, especially with the strategic framework and the diversity papers that were done. Absolutely, we could not have done it without the support from OHA staff in this work. So again, I just wanted this committee to be a working, functioning committee that really drove the work that we wanted to see done. So I think in 2024, you know, as we figure out, not me, because I'm not going to chair, but as we figure out where the committee is going to take the next level with these diversity and the strategy papers and the strategic framework, it's for me, I would think I really would like to see that working concept continue. I think we'll, I don't think we're going to be able to take that forward without support from OHA staff, though. Like Elena, I just want to acknowledge what Elena said. It was daunting work with those papers. I looked at some of the content of those papers, and I'm thinking, how did they do that? Because there's no way that I'm thinking I could not have done that. So it was to me, it was daunting work, but I really think that that we're going to be still needing some support from OHA moving that work forward. You know, we're going to have 3 subcommittees that will maybe work on this. I don't know what the structure is going to look like yet, but I'm hoping that we'll still get that support from OHA staff on how to move and engage and drive that work forward. So I will be I'm not happy to step down as chair by any means, because I love this work and I love doing this, but I will be happy to see where the next chair and vice chair go and the work going forward. So that's my 2024, and I'll open it up to committee members. Don't make me call on you, because I will. Actually, I'm gonna call on Ian. Ian, because you joined the committee in 2023. Sorry to put you on the spot, but I wanted to ask you, given what you saw in 2023 as your first year, what do you see for 2024, given what happened in 2023? If you don't mind.
Oh, not at all, not at all. So from what I'm hearing and what I'm seeing, and please note, this is my own bias anyway, is seeing more data and more, I mean, one of my old mentors said, if you can't see it, you can't manage it. And if you can't manage it, you can't move it. And really looking at bringing in more concrete data and being able to take more concrete action from it is one of the things that I see us moving towards.
That's great. We always say if it's not documented, it doesn't exist. So it has to be documented. Before I forget, I saw, and Mark sent me a note earlier that Judy Geiger is a committee member as well, and she was able to join us. So thank you, Judy. Judy, I don't want to put you on the spot, but I'm going to put you on the spot. Do you have any thoughts about 2023 or 2024?
Let me see if I can put my video on. Well, I have learned, I guess I have just learned a lot about being on this type of a committee over the past year. I've been so impressed by the amount of work that some of the people on the committee were able to put into everything that was done by this group. And I feel like I was a little bit of a slacker in comparison to many of the members on the group, but I have learned a lot, and I really am happy to be here. And I agree with what everybody else has said around things that going forward we should be working on.
Thanks, Judy. I'd also like to open it up to OHA staff. Neelam, I know you've been very, very actively participating in the work that we do. And so I would really love to hear your thoughts about the committee work, if you don't mind. I'm putting you on the spot too. If you don't mind sharing with us your thoughts about 2023 and 2024.
Yeah, no, I really appreciated the really rich discussion from earlier. There's so many things I'm proud of from this past year. It was quite a busy year with starting off with the approvals of the healthcare workforce needs assessment and the provider incentives evaluation. I know it was a lot for newer committee members to kind of jump into and absorb, and for that I'm so appreciative. And then the tremendous work that was done around the taking all of the over 20 recommendations in the healthcare workforce needs assessment, and as as was mentioned earlier, developing the strategic framework, and then the tremendous work of the subcommittee chairs and all the so much participation from the entire committee in the development of those strategy papers. And I'm also really proud of our healthcare provider incentive program team for their excellent work in making recommendations for the distribution of funds for this biennium. And getting approval from the Healthcare Workforce Committee and the Oregon Health Policy Board. And as proud as I am, there's still so much work to be done. And so I'm really excited to continue to partner with everyone to take, the ideas that were generated in 2023 and really, move those forward, in this next year and beyond. And, it seems like it's well and in alignment with the Oregon Health Policy Board priorities. And then I'm also really looking forward to, I know Mark, and there's been a subcommittee of this committee that's been working on establishing a new charter for the group. I'm really looking forward to introducing that soon and getting feedback and getting approval on that from the Oregon Health Policy Board.
Thank you, Neelam.
Oh, and then, Laura, if I can just mention too, I know it's been about a year since we had the last provider incentives evaluation and healthcare workforce needs assessment reports approved. Those are on 2-year cycles. So we're just starting to plan for the 2025 reports.
Perfect. Thank you. Dr. Hemmings, if you don't mind, I'm curious to get your thoughts on 2023 and hopes for 2024. You've been on the Healthcare Workforce Committee, and are you going to stay on the Healthcare Workforce Committee even though you're with the Health Policy Board now also?
Good questions. For 2023, I would agree with everything that Paul said regarding work on the papers. And what I am looking for in 2024 is to actually see those recommendations being actualized. And I'm not sure what role this committee plays in actually, what the next steps are in terms of actually making those recommendations into reality. As far as my role in the committee, I don't have any plans of not being on the committee at this point. So that's kind of where I'm at. I think a lot of work went into working on those papers, and I'm always concerned about how long it takes to actually create change within systems, and in this case within the state. And I have some concerns about what's next and where that goes. And I am not sure how much power this committee has as it relates to next steps, as relates to those papers. And I'm also not sure where the health policy boards, what role the health policy board actually could play as it relates to taking those papers to the next step. So I'll be curious to find out answers to those questions.
Me too. I think it'll be interesting just to see your perspective, from the Healthcare Workforce Committee work and the Health Policy Board work. So I think it's going to be a very unique, what's the right word I'm looking for? Partnership maybe. So yes, I'm excited. I'm actually excited about that. And I appreciate your comments. Thank you. Anyone else? Dr. Chaudhry, Gabby, Aubrey? Not that I'm calling on you, but any thoughts?
Hi, this is Gabby. 2003 was something very impactful for me. I'm one to just stay quiet. I like to sit in the back seat of a huge classroom and just listen. But 2003 really gave us an opportunity as committee members to actually give an opportunity to give our feedback. I was part of the subcommittee for diversity, which is something that is really deep in my heart. And I worked for Multnomah County for 8.5 years and really had the opportunity to experience diversity with patient population as well as staff, and being able to work on that subcommittee and having a voice, being able to give that feedback and have a say in the papers that were written was really important, something that stood out for me as being impactful. And then knowing that in the future, 2024, hopefully, and in the future, as Dr. Hemmings has said, is seeing how all of that work is going to be put into practice. So that was something that I got to look forward to and want to continue to look forward to in 2024. So thank you for the opportunity.
Thank you, Gabby.
I could talk. I don't know if you can hear me.
We can, Aubrey, go ahead.
Awesome. Sorry, I've been in and out seeing patients. Unfortunately, they did not block my schedule this morning. So I've been a little scattered, but I know I'm stepping off the committee and just kind of reviewing these questions that you asked here, and wanted to give a lot of gratitude for all of the work that you all do here. As a provider that is working in the workforce, as many of us are, it's really impactful to see everything that goes into this, and how much work goes into making a piece of change that just feels really impactful down the line. So I think, just being part of all of these meetings and the subcommittees and seeing the amount of work that goes in has been really heartwarming and a really big lesson for me. So yeah, just passing that piece of gratitude on and just recognizing how much work you all do. Sorry, I didn't get to do much more working as much as I do, but I greatly appreciate everything that you all contribute.
Thank you, Aubrey. We appreciate you too. Dr. Chaudhry?
I think everyone has spoken extremely articulately, and there's no way that I can match any of that. There's only just two kind of words that I feel resonate as I reflect on 2023 and as I look towards 2024 and the impact of the work that we've been performing over the last few years into the future. And the first word is uplifting. Every meeting that we have and that we've shared and we've had discussion on is very uplifting. And I feel a renewed sense of joy and hope as we look towards the future with each and every single meeting that we've attended. And so I think the two words were uplifting and joy. So thank you, OHA staff. Laura, thank you for your leadership. Brenda, thank you for your constant support and empowerment that you've provided. I think by continuing to build the bridge in terms of how the Health Workforce Committee fits into as a cog into the entire system, I think that in of itself has been very empowering to see and visualize the bigger picture of all the different pieces that we're trying to collectively build together. So really looking forward towards the future. And that's all. Thank you.
Dr. Chaudhry, appreciate that. Okay, well, we have a lot of work to do in 2024. I will be excited to see that where that takes us and pass the helm. I did earlier put my email address in the chat if anyone wants to email me, self-nominate if you would like, that would be great. I did want to take a few minutes before we sign off. If you could go to the next slide, Jessica, please. And one more. Perfect, thank you. Again, we have 4 members that are going to be departing the committee. Bhavesh was not able to be here today. Paul, Daniel, and Aubrey are all here. And I just wanted to ask the 3 of you that are here, do you have any parting words for us or any thoughts that you would like to share about the time that you spent with us on the committee? I did want to also acknowledge your work and your presence, and thank you very much for your contributions to the committee. But I'll just turn it over to you if you have any thoughts you'd like to share with us.
Hey, Laura.
Well, I'll
this
just
is
say
Dave.
what I said before. It's been
Go
a great pleasure and learning experience to work with all of the folks on this committee. And I think the committee's been doing really strong work for as long as I've been on it. And I think we're actually in a better position for future work now with all the work that we did this year with the strategic framework and the paper. So I'm very encouraged about the committee's future and appreciative of all the work we've done together.
Thanks, Paul.
Can you hear me okay, Laura?
I can. You're a
Yes,
little
thank
bit low, Daniel, but we can
Is
hear
this better?
a little.
Yeah, well, so first of all, I wanted to thank everybody for all your contributions and the wealth of perspectives that you have shared throughout the last 3 years in the committee. And I commend you all for continuing the work and supporting the healthcare workforce in the state. It's been a pleasure working with you all, and I wish the committee and everybody the best. Thank you.
Thanks, Daniel. Aubrey? Wasn't sure if you were here, if you had to go see a patient.
I'm here.
Okay.
Luckily I will get a lunch soon, so that's not I get a little bit of a break now. But yeah, no, I would just echo what I said previously, and just so much gratitude for everything you all do, and it's been really encouraging seeing all this work. So thanks for allowing me to be a part of it for the last 3 years.
Thank you. And don't forget, this is a public meeting, so come back anytime and join us and listen in, and we welcome the voice and contributions. So again, thank you for all that you all have contributed and your service to the committee. I very much appreciate it. And I think with that, we might end a few minutes early. Our next meeting is March 6th of 2024. But again, please email me if you would like to self-nominate for chair, vice chair. If there is someone that you think would make a good chair or vice chair, if you want to send me their name, I'm happy to certainly reach out to them and see if they would be interested. So please do that so we can get a slate of candidates that we can have for the next meeting. Again, if anyone has any questions, concerns, feel free to reach out. One more acknowledgement and thank you to the OHA staff for all of your support. The last few years, at least for me that I've been on the committee, and previous years, we certainly couldn't do it without you. So thank you for that. And if there's no other questions, comments, concerns, discussion, we can go ahead and adjourn the meeting until March. So thank you. Thank you. Oh, Mark, I just saw what you put in the chat there. We're looking to hold an orientation the morning of, is that for March?
Yes, Laura, that's right. Just for the returning members, know that you'll be invited to come for a 10:30 start time rather than the 9:30 start time. And you are definitely welcome when we schedule the orientation for before the business meeting. If you'd like to get a reorientation, remind yourself or contribute to the new members, you are definitely welcome to do that.
Perfect. Thank you so much. Thank you, everyone. Have a good rest of your day, and we'll see you in March.
Thank you. Take care, everyone.